One thing I talk to a lot of my patients about is the eyebrow. A lot of people come in thinking they have heaviness of the upper lid, and that's their main problem, and it can be the case. But the eyebrow plays a role as well. We all have a little bit of heaviness that develops in our brows over time, and the brows affect the skin of the upper lid. Now, a brow lift procedure is not a one-size-fits-all procedure. There's really a lot of different ways to approach it. In my practice, I take a minimal approach, and honestly, it's going to be as minimal as it can be to achieve our goals. There's two main approaches that we take. One is called an endoscopic brow lift. This is a surgery that can be done usually in the surgery center, but with minimal incisions because we use an endoscope or a camera to do the surgery. The incisions are placed in the hairline and hidden, and usually about an inch long across. So what we're aiming to do is elevate the brow back into a natural position so we can create the space we need to make that nice, natural, bright eyelid shape at the same time. Now, a lot of people fear unnatural results after a brow lift. We've all seen people on TV, people in our lives maybe, that have had unnatural results after brow lifting surgery. It doesn't have to be the case. This surgery, like any surgery, can be done in a balanced fashion where we're replacing the brows into a natural position, but not placing them too high where we're trying to create an overlifted or surprised appearance. Most of my patients don't need that level of a brow lift. They come in with a little bit of heaviness, mostly on the outside of the brow. And this is referred to as the temporal brow, or really you can think of it as the arch of the brow. That outside area of the brow tends to fall slowly with time, and it creates a down and out shape to the brow and to the upper lid. Now, upper eyelid surgery can get a great result, but if we have heaviness of the outer part of the brow, that area is going to be limited if we just take an eyelid surgery only approach. We want to make sure that we're balancing that part of the eyebrow with our eyelid surgery. We can achieve this with something called a mini brow lift, where we're placing two small incisions hidden just behind the hairline to only elevate that part of the eyebrow into a more natural position. The lift is subtle, but so important in creating that natural almond shape to the eye and lifting that full, heavy outer part of the brow. The results can be great, long-lasting, and most importantly, very natural.